And now to health matters. The United Nations Children Fund, Nigeria, that's UNICEF, is sounding the alarm about the urgent need for widespread vaccination against diphtheria. This comes amidst the most severe diphtheria outbreak in recent global history. UNICEF, in a statement, said the outbreak has so far resulted in over 11,500 suspected cases, more than 7,000 confirmed cases, and claimed the lives of 453 people, mostly children. Most cases are children aged between 4 to 15 years who have not received even a single dose of the vital vaccine, laying bare the urgency of the vaccination situation in Nigeria. Similarly, the president of the Nigerian Medical Association, Dr. Uche Ojinmah, urged the federal government to put in place a systematic pattern of prevention and action to curb disease outbreaks in the country. Now, joining me to discuss more on this is Dr. Patricia Akintan. She is the head of Paediatric Infectious Disease Unit at College of Medicine, University of Lagos. Good afternoon, Doctor, and thank you so much for joining us today.
Good afternoon. Thank you for having me.
It's a pleasure. All right, so diphtheria seems to be gaining the ground in Nigeria, whereas other countries are far from it. Now, what could possibly be the reason, and what needs to be done? What urgently needs to be done?
Well, thank you. The diphtheria situation we have in Nigeria is actually multifactorial. A lot of ignorance. People don't know what they're supposed to do. Children haven't been vaccinated. People don't take vaccination seriously. They have myths against vaccination, all kinds of stories spreading around. But the bottom line is that if the child has no protection, when the disease comes, the child is going to get the disease. So our vaccination coverage is very, very low, and that's where we find ourselves right now.
All right, so for the sake of those who might still be wondering what diphtheria is all about, can you tell us more about this particular bacterium?
Well, for the general population, I would like to say I'll call it a germ. What it does is that it affects the throat. I want to make it very simple so that everybody will understand. Make it very simple, and affects the throat. It usually starts like a sore throat. They think they have a sore throat, and then they go on to difficulty in swallowing. Then it forms this dirty sheet around the neck that covers the neck. So the child is unable to swallow. The child is unable to breathe. After a while, they won't be able to breathe because the sheet covers the whole of their throat, so they are not able to breathe. So they have difficulty in breathing. Then, of course, later their neck begins to swell. It looks like a bull, So, and that stage is actually very late. So the best way is to pick them very early and do not allow them to get to that bad terminal stage.
Okay, Doctor. Now, the president of the Nigerian Medical Association, Dr. Uche Ojinmah, has urged the federal government to put in place systemic patterns, of prevention and action to curb disease outbreak in the country. Now, in your expert's opinion, what systematic patterns, can be used, or can the government actually put in place to be able to curb these particular outbreaks, especially diphtheria, in the country?
I think the way to go is vaccination. Ensure that every child gets vaccinated as when they are due. In our communities, people think that vaccination ends when the child is 9 months old. It doesn't end at 9 months. There are vaccinations even at 50 you have to take. Remember when COVID came, we all got vaccinated. So for a child, it doesn't end at 9 months. The child needs what they call a booster dose. And I think that's what you should do, that every child ensure before you get to primary school, make sure your child gets your vaccination. And you should ensure that every child gets vaccinated in Nigeria. That is the only way we can stop the curve of this. We can stop this diphtheria trend that is going on around the country. And if we don't do that, we are not going to make any progress. I don't see any progress beyond us vaccinating our children and make sure they are well vaccinated, not just one dose and they disappear, and the mothers disappear. Complete vaccination.
All right, now, Doctor, talking about
complete vaccination, that is what should happen.
All right, talking about vaccination, now you'd agree that some quarters are for it while some other quarters are totally against vaccination. But how is it possible to achieve herd immunity when it comes to vaccination, especially in diphtheria cases?
Some of the children that we're seeing now are actually for in our own centers. They are 7 years old. So I presume that they probably most of them their last vaccination was when they were 9 months. They never went back to the hospital again. So if you want to get good herd immunity, it's continuous immunization. Like I said, if you vaccinate a group of children and they grow, another set are being born every day. Children are being born every day. So we keep doing it every time, regularly. So we don't leave anybody uncovered. We don't leave anybody uncovered at all. When we leave a group of children uncovered, then those are the places where the germs begin to thrive. So routine vaccination. Every child should have the opportunity to be vaccinated, and enough dose to cover them and protect them from every infection that they need to, that they are prone to. Then of course look at give people information. Let's give people information. People don't know what diphtheria is all about. Public enlightenment in different languages. Improve nutrition. Children need to eat well. Parents should be taught what the children should eat. If a child who is well nourished is likely to come down with an infection. So these factors are multiple, but the fastest for us to do now, I think, is to vaccinate all our children and make sure every child gets vaccinated. Talk about it in our churches, in our mosques, in our religious centers, in schools, everywhere, and let children get vaccinated.
All right, well, thank you so much, Dr. Patricia Akintan, for your expert's opinion on this particular issue.
Thank you.